Good afternoon, everyone. Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de ce point de presse. Before we begin, a quick reminder to place yourself on mute until I invite you to speak or to ask your question. Available for questions from the media we have, disponible pour répondre aux questions des médias, nous accueillons in Council Chambers, Mayor Le Maire, Jim Watson, Steve Kanalakos, City Manager, Directeur Municipal. Phoning in today we have Councillor Keith Eglai, Chair, Ottawa Board of Health, Conseiller municipal Keith Eglai, Président du Conseil de santé d'Ottawa, Dr. Vera Etches, Medical Officer of Health, Médecin-chef en santé publique, Kim Ayotte, General Manager, Emergency and Protective Services, Kim Ayotte, Directeur Général, Service de protection et d'urgence, and Phil Landry, Director, Traffic Services, Directeur, Service de la circulation. I will now invite each agency to ask their question. You may ask one question and one follow-up. Par ordre alphabétique, j'invite maintenant chaque organisme à poser une question et une question de suivi. If for some reason we lose you during the call, please try phoning in again or contact Media Relations to submit your question. So we will start with Joanne Chianello at CBC Ottawa.
Hello, good morning and Happy New Year, everyone. The first question actually I have is about an event happening this weekend. If I could get comments from the mayor and Dr. Etches about the truckers' protest that is on its way to Ottawa for this weekend. Just some comments on the protest itself, what you think of it, and sort of the city's response to it.
I was just thinking, Joanne, when we always call on you first, it reminds me of that reporter in the White House, Helen Thomas, that was the doyenne of the press corps, and she always got the first question. But
I think it's the oldest person covering City Hall. That must be it.
That would be me. Well, thank you very much, and Happy New Year to you, Joanne, and your colleagues on this call. First and foremost, obviously, I don't support the cause of the truckers. I think people should be vaccinated if they're working in areas like long-term care homes and hospitals and the like. Secondly, I would encourage residents, if they can avoid the downtown core part of Friday and Saturday, to please do so, or work from home if that's at all possible, so that we don't add to the congestion. Third, I ask the truckers and the organizers to be respectful. You're coming into someone else's community, someone else's neighborhood, and please respect that. Make sure that you keep passageways clear at all times, especially for emergency vehicles. We're in the midst of cleaning up from a very heavy snowfall that has narrowed the streets, and the last thing we want these truckers to do is to block off a street that an ambulance or a police car or a fire truck won't be able to get through. So those are just some words of advice I have. We don't know how many people are coming and how long they're going to stay for, but we expect and ask them to obey all provincial, federal, and municipal laws. Thank you.
Could I get that in French before Dr. Etches answers? Thank you.
Certainement. Je ne suis pas d'accord avec le message ou le thème de cet groupe des personnes qui sont responsables pour des camions. Mais à la même temps, il avait le droit de faire ça, premièrement. Mais deuxièmement, s'il vous plaît, les organisateurs, respectez les lois fédérales, provinciales et municipales. Ne bloquez pas des roues parce que c'est les roues pour les paramédics, des pompiers et la police. Et c'est important de répéter que vous êtes un visiteur dans un autre quartier, une autre communauté. S'il vous plaît, respectez cet quartier et les résidents qui habitent dans le centre-ville. Merci.
Hi, Joanne. My focus, of course, is to try to increase the people in Ottawa who have received first and second doses of the vaccine. So I would like people, if they're discussing vaccination, to understand that it is important protection. The first and second dose really don't stop completely transmission of the Omicron variant. We see this, but they do make a really significant difference. They decrease your chances of hospitalization by 70 to 80%. So that's important for individuals. It's also important for us to be able to have a health system that's functioning. So the more we're all protected, the more we keep the pressure off the hospitals and our health system. And that contributes to being able to open things up when we don't have pressure on our hospitals. So I just really, the focus of our team at Ottawa Public Health with the city is also continuing to make vaccines accessible. So people can drop in to all of our clinics now for first, second, or third dose. That third dose even further protects against hospitalization, by 90+%, we're learning. So that's our focus right now.
Okay, and my follow-up, I guess, is for Dr. Etches as well. I know there's lots of people who are hoping their teenagers can get their third doses soon. I take it that is up to Health Canada to decide that. But is there any sense that soon PCR testing could be expanded to more people, so that people know whether they have COVID or not, especially as people are going back to school these last couple of weeks?
Well, we are in a transition of how we approach the pandemic because of the Omicron variant being highly transmissible. The utility of a test and try to trace system is really, it's limited. The vaccine's good protection. That's also changing the environment for us. But what we know is the PCR test. People have to have symptoms and they go for the test, then the lab has to get it and they have to turn it around, and that's almost taking as long as the recommended isolation period of 5 days for most people. And so it's not a necessary tool to change how we approach and manage when we have symptoms that could be COVID. We need to stay home and do that isolation, assume it's COVID in this context. That isn't likely to change. We have a lab system that has only so much capacity, only so many staff that work in the labs that have those skills. So the priority for that system is to diagnose people who need treatment in hospital, or there's other outpatient settings where treatments are going to become available. It's to control outbreaks in high-risk settings like shelters or long-term care. So I don't anticipate a change. What I do see coming is more availability of rapid antigen tests. Again, how those have been recommended to be used have changed over time. We see that the virus, the Omicron variants, that they're detectable earlier in the course of the illness, and with higher prevalence in the community, it means we can have more confidence that a positive rapid antigen test is COVID. For negatives, you need to have 2 tests 24 hours apart to be more sure that it's not as likely to be COVID. So the rapid antigen test supply is really what we're looking to see grow and be more available for different sectors.
Thank you.
Thank you very much. Moving on, we'll be going to Perushka Gopalkiskita at City News Ottawa.
Hi there. Hi, everyone. My question is for Dr. Etches. As schools return to in-person learning and students, are able to get in schools with teachers and friends, is there anything you're worried about in terms of COVID-19 transmission amongst kids right now?
Well, I would like to see us approach all of our interactions with caution still at this point. We still have high levels of COVID-19 in the community. So my recommendation for families is to prioritize the school setting, knowing that there can be exposures in school, and think carefully about what other exposures are added in the community setting. So what kind of social activities, sports activities. Some of these are important for children's health. There's no question. We understand that. We're just trying to proceed step by step, have children and youth back in school, get them then after that back to the activities that make a difference for them as well. And so it is about, if you're sick, staying home from those activities, staying home from school. That's the most important thing right now for people to do the daily screening, and that will help to limit COVID transmission.
Great, thank you. And my follow-up question is, what do you think about these Facebook groups or these families in the Facebook groups that are taking it among themselves to do their own contact tracing and their own follow-ups if there's any COVID cases in schools? What do you think about that?
Yeah, I mean, I do understand parents want to have as much information as possible to decide about sending their children to school. And I know, the approach is different now where there's not the same kind of information and follow-up to dismiss a whole cohort of children if someone in the class was positive like we were doing. This has changed. And I want to explain a little bit that this is a different virus. In terms of the variant, it moves quickly. And so people are infectious 2 days from before they have symptoms, and most infectious for the following 2 to 3 days. And so by the time somebody has a test and they report that test, and there's probably already been some exposures in the school environment. And so really what's important is that everyone going into school is always thinking about, might have been exposed to COVID. I'm going to make sure if I have symptoms, I stay home when I'm sick to slow down and not continue to spread COVID. So the action that individuals need to take doesn't change based on whether there's someone in your class tested positive or not. There's no more dismissal of a whole cohort. It's about that daily screening for symptoms and understanding if you need to stay home and following the provincial screening tool to follow that advice. I think there are some things to be careful with as people set up their own systems for notifying it. I would like to make sure that people think very carefully about privacy. And there are times when someone could be identified as having COVID. And I think, that can cause blame, it can cause stigma, it can cause shame. None of those things are warranted. This is a virus that, it's going to be hard for people to not, at some point encounter it. So it's no one's fault when they get sick with COVID. So we'd like to avoid that kind of negative outcome. And the other thing to keep in mind is if people are hearing a report from their school or their class, it doesn't mean that COVID's not there, right? So we can't have a false sense of reassurance when we don't hear reports. We have to assume that it could be, and then therefore use the other measures, use the masks, use the distancing, use the daily screening to really have other protections and also work to slow down COVID being entering into schools or transmitting in schools.
Thank you so much.
Thank you very much. Moving on, we'll be going to Josh Pringle at CTV Ottawa.
Thank you very much. My first question is for the mayor and maybe Steve Kanellakos, if he could weigh in. We were just wondering, with the protest set for this weekend in Ottawa, what will city staff be doing to assist Ottawa police and law enforcement to make sure that traffic is still moving and everything is still safe for people downtown this weekend?
Yeah, I'll ask Steve Kanellakos. He's heading up our response with our Emergency Operations Center and working with the police. Steve?
Hi, Josh. Happy New Year to you too. And there's a briefing this afternoon or just in 10 minutes at the Ottawa Police Services Board that Chief Slowly will be giving, but we've obviously been engaged at the city. So this is led by the police, the National Capital, regional police services and law enforcement agencies at the federal and provincial level will be engaged. We are bringing a unified command together, and the city has a role in that obviously our traffic management emergency group has been pulled together. Our emergency operations center is also going to be pulled together. Our other emergency services, paramedic and firefighters are also part of the National Capital group that the police are heading. So there's many, bylaw obviously is involved. So we're all integrated right now into a centralized command structure for the National Capital Region to ensure that we're able to understand what's happening and be able to respond accordingly and do all the planning leading up to this weekend.
Thank you. My second question is for the mayor. You moved a motion today to name a street after Ryan Reynolds. Why name a street after Ryan Reynolds, and why not name streets after some other famous Ottawa residents like Sandra Oh, Alanis Morissette, Tom Green?
Well, we have streets named after Rich Little and Paul Anka. We gave the key to the city to Alanis Morissette as well as to Sandra Oh. There are different ways to honor different people. I was very impressed with the fact that Ryan hasn't forgot his roots here in Ottawa and in Vanier, and that he's on his own initiative, not looking for any publicity, instigated funding to the Ottawa Food Bank as well as to the Distress Center. He picked up the spirits and morale of our folks at Ottawa Public Health with Bruce the intern, even taking time to speak to 3 11-year-olds, the interview dudes that have a podcast. Having him on their show helped them get other big names on the show. So I think it was a decision that I made a couple of weeks ago, and he was very flattered when we contacted him, and we look forward to the street being developed over the course of the next year. Thank you.
Thank you very much. We'll now be going to Julien Paquette. On va passer à Julien Paquette à Le Droit.
This is Julien Paquette, Le Droit. My question is for Mayor Watson. In your speech today, you said that since the light train started, you're achieving a performance of 99%. There were some incidents. We had one Saturday morning. Are you worried about that? Do you think that we will be facing new issues? Or this is only once in a while one of those incidents that can come up? Of course, we had a few challenges Saturday morning, but it's the same situation with other public transport systems after a storm. We had a big storm on Thursday and Friday. The service was good on Thursday, but as you know, there's always some challenges. We're still working with RTM and Alstom to improve their services. I trust that the new General Director, the OC Transpo General Director, and the other company that is working with us will be looking into that, submit their recommendations for further improvements. Like we said in November, we were reaching, on average, 99% performance. But we had an incident on Saturday morning. Follow-up question? Following the Saturday morning incident, it took about 24 hours to find a solution. So are you satisfied the way RTM intervened? Are you concerned? Was it too slow when we're talking about an intervention? Mr. Kanalakis told me that they found a solution about 30 minutes after the issue, but they wanted to proceed with a more complete exam in between Blair and Tony. So they were looking for if we had any electrical issues. They had to test the whole system, and it takes more than 30 minutes. Every week, every month, RTM personnel proceed through different tests to improve the situation. So the objective is to have a good system that is traveling frequently. So we, like I said, we are working with RTM and RTG just to make sure that the system runs smoothly. We want to have a more reliable system for our citizens.
Merci
Thank
beaucoup.
you.
We'll now be going to John Willing at the Ottawa Citizen.
Hi, Kina. Thank you. Question for maybe Mr. Kanalakis, and it has to do with the truck convoy arriving this weekend again. And I'm wondering how the city is going to manage all these transport trucks coming into the downtown area. Are you going to have to kind of escort them, or police are they going to have to escort them down to the hill, set up special routes? And I'm wondering, Steve, if organizers have been cooperative with the city as they move closer to Ottawa.
Yeah, hi, John. Yeah, that's what the planning is. I referenced the question earlier. The planning is happening for that now. Ottawa Police are in contact with the organizers. They're working with them. So we're trying, like Ottawa Police does a great job dealing with protests. We have many in Ottawa, more than any other city in Canada. So they have a great expertise in dealing with them and negotiating with the protesters in terms of to ensure, as the mayor said, there's, emergency safety routes are there, how they park, how the downtown's still accessible, how we're going to deal with the number of trucks, where will they be placed. All that's being worked on, and Chief Slowly may have more information at the police board meeting at 1 o'clock. But that it is, I guess, the best way to describe it, and from my police conversations, is the situation's fluid. I mean, we're gathering information, and it's not hard information yet in terms of the numbers, what they're doing. So, but the main point is that Ottawa Police are speaking with the leaders of the protest and working with them to ensure that we have a peaceful demonstration and that respects the city and the requirements of the rest of the residents of the city. And I hope that that actually comes to fruition.
Great, thanks, Steve. Question, just shifting gears. Mayor Watson, I'm curious to know what your position is on Councillor Dean's proposal to send $100,000 to the legal fight against Quebec's Bill 21.
Yeah, as you know, Council's already approved a motion similar to what the councillor has brought forward. I don't support using tax dollars to fight another level of government. I think what has happened in Quebec is completely divisive and abhorrent. Religion and state should be separated, and people should have the right to wear religious symbols when they go to work. But taking $100,000 out of the City of Ottawa, I don't support. The Federation of Canadian Municipalities has a fund that would be more appropriate. They've used it for past legal challenges, such as the City of Toronto's fight against the province for reducing the size of council. But we have to stay within our sphere of responsibility. And if we start spending money on things that are outside our jurisdiction, even though we detest what the government is doing, we can do that through the motion that was presented, I believe, a year ago or less than a year ago by Councillor McKenney. And now we have a motion by Councillor Deans saying basically the same thing, but this time asking taxpayers to pay for it. And that's something I won't support. Thank you.
Thanks, Mayor.
Thanks, John. We'll now be going to Jackie Miller at the Ottawa Sun.
Thank you. Hi. Question for Dr. Etches about schools. A couple of medical officers of health in Niagara and Peterborough have said they will continue to dismiss entire classes if there's a self-reported COVID case in the class, that it's disruptive, but it'll prevent the spread at school. I'm wondering if that's something that you would consider doing, and why or why not?
Thank you. The context I'm operating in is that we are, looking at the transmissibility of this virus and trying to minimize morbidity and mortality, as well as maintain essential services. And so school being an essential service for children and youth, the disruption of learning is there when whole cohorts are dismissed. It is not considered a high-risk environment compared to long-term care or hospitals. And the measures in place, like the screening every day, the masking, the distancing, are meant to slow down the introduction or transmission of COVID in the schools. So I am continuing to follow the provincial guidelines, which don't require dismissal of cohorts in general. However, there may be times when this is called for based on what we're seeing. And this is why we are in a period of monitoring and evaluating and working closely with the principals. There's the absenteeism, people talk about the threshold of 30%, but we're looking at anything that's concerning to principals about what they're seeing in a cohort and, is something they can discuss with us. And we're reaching out proactively where we see, higher levels of absenteeism or patterns changing. So we will continue to assess how things are going. I think that answers your question.
Yes, thank you. But my follow-up, if I could ask you about the reporting on absences, if they rise, 30% above the normal absences, public health will be notified. But what I'm unclear about is once you're notified, what will you do about the situation, given that classes and schools are no longer being dismissed? Everyone can, stay in class and watch for symptoms. So what is even the point of notifying public health?
This all remains to be seen, but we're not waiting. I think that's part of what I mean by we're in a transition period where we need to evaluate and monitor. So we are proactively taking a look at the absenteeism levels ourselves, not waiting for the 30% threshold. And where we see that they are higher, we're reaching out to schools to understand what's behind that. So we'd like to know, is it because many people are choosing to do online learning? Is it because we have an illness? Is it because of something else? Just try to understand, is it all in one class? Is it across many? Because, if we see concerning patterns in transmission, there may be practices we need to reinforce. There may be situations where the exposure could have been higher risk, and so we want to address these things. So we have public health inspectors, we have school nurses, we have an infection prevention and control team, that this is part of their ongoing work, is to look at this and support school and childcare through this transition. I think the thing also I didn't mention in my first answer, that dismissal of cohorts doesn't stop transmission. It won't stop transmission necessarily. Right? The community surrounding levels of COVID are an ongoing source of introduction into schools. So the first thing we have to do every day is check whether we have symptoms that could be COVID. And we know that this is challenging, but this virus is challenging, especially with Omicron, because of how quickly it moves and the days before symptoms when you're infectious. So, overall, we're not aiming for a COVID zero environment. We're aiming for mitigating the harms and protecting people at higher risk.
Thank you.
Thank you very much. Nous allons maintenant passer à Frédéric Pépin, Radio-Canada.
Frédéric Pépin, Radio-Canada.
Bonjour à tous.
Hello.
Ma question en français s'adresse probablement à Monsieur Landry, peut-être.
My question is for Monsieur Landry, possibly Mr. Ayotte. Looking at the convoy that's coming into Ottawa this weekend, you talked about it in English, but I would like to have your comment in French. What is your plan? What kind of preparations are you putting forward? How will you help Ottawa Police Services to control, let's say, traffic during the protests? Hello, Frederick. Thank you very much for your question. Like Mr. Kanellakis explained earlier today, the police has a responsibility to take in charge the protests. Like it's not the first time in Ottawa that we have a protest. I think we have specialists on that topic. Here at the City of Ottawa, we will be working hand in hand with them. We will have communication center that will work in collaboration to manage traffic and any other issues that we may face. We have personnel that would work in close link with the police services. Right now, we're watching social media to see what's going on in the other cities they're going through. We will see what this will give us an idea of what to expect here in Ottawa. Right now, the situation is very fluid. We have an idea of what may happen, And we're very serious about tackling all of the potential issues. Does it answer your question? Follow-up question? Like you said, you think that this protest will be very big? We're going to have very long heavy trucks. This is not the usual. Normally, normally we have people walking in the streets. Do you think that you will need some reinforcement, asking personnel to show up, maybe Friday night, maybe Saturday morning? Is that in the plan? Thank you for your question. Yes, we will ask help from the firefighters and the paramedics, making sure that we have all the resources needed. We are also working with the organizers. We're explaining to them that the street have to be free for the firefighters and any type of emergency vehicles. They also told us that they will do the maximum so that we can ensure the safety of the residents. If not, we have different techniques that can be used, but we will be continuing to work with the organizers. Right now, we want to manage as much as possible the circulation just to make sure that the emergency services can reach their clients. Thank you so much. That's the end of our press conference today.